And then I have a question from, okay, here. If someone had COVID and got C. diff and was told if they take again, they would definitely, is there something? Yes, right? Is that statement is not wrong, right? Because it has a lot to do with your internal, uh, let me change my view. For some reason, I am looking at me. I don't like to look at me. So, okay, gallery, perfect, right? I feel weird, looking at me talking like, all right. So I am not that into myself, but anyway. So yes, because it has a lot to do with your intestinal flora, right? That means what is the proportion of good bacteria you have versus bad bacteria in your gut. So of course, right, antibiotic can destroy that. And so when that happens, you're much more likely to get C. diff. So one way to prevent that is to take good probiotics always, right? I'm a big proponent of probiotics, right? Because that can help reestablish the balance of the bacteria in your gut so that if you do take antibiotic again, it's much less likely to get C. diff. In fact, C. diff is a result of bacterial imbalance in the gut. And there's a name for that. We call that dysbiosis, right? Dysbiosis is the name we use to describe the bacteria imbalance in the gut. So when the good bacteria are killed by your antibiotic, the remaining C. diff can surface, and that can cause C. diff. And other bacteria, if you have too much of those, that sometimes can also lead to sepsis, right? Sepsis means the bacteria now is traveling in your blood and can now go everywhere. So it becomes a systemic infection, right? We call that systemic infection, meaning sepsis is now, the bacteria somehow get into the bloodstream, traveling everywhere and causes major problem. Yes, okay. So I would definitely say that take good probiotics, right? And again, Colleen can share with you a lot about, oh, so tell me some of those good probiotics, right? So I know Colleen has now become an expert in nutritional supplementation in my office. So you can ask her those, and also Heather, of course, right? Okay, so continuing the next question would be, if you recommend a probiotic, the two places you recommend them, they offer how, oh, okay, so that, yeah, so that depends, right? Yes, of course, probiotics come in different strength, right? And of course, depending on the condition, usually you can take probiotic for health purposes. Like there's nothing wrong. I just want to make sure that my gut is healthy. Then you typically take a lower strength. But for those patients who have problem, right? They definitely have um, this bacterial imbalance in the gut and they're having symptoms like abdominal pain, diarrhea, constipation. Well, then I would use a higher dose, right? So typically, higher doses is for patients who are sick. Lower doses are for patients who just want to be well, right? It's like taking multivitamins, right? Yes, you can take a multi, kind of, if you feel like, yeah, my diet is not that good, so should I take a multivitamin? Sure, right? But is it going to help when you're sick? No, right? Multivitamin is really more for, well, I'm not sick, I just want to maintain my health. But when you are sick, then we have to use much more targeted, right? Let me write this down. Uh, we want to use, we want to use, when people are sick, we want to use targeted, right? Targeted nutritional supplement. And that oftentimes will means a higher dose, right? A stronger, right, a strength. So let's continue. Again, stop me anytime if you think I am not being clear or if I speak too fast. Sometimes I do speak faster after coffee, right? I need coffee to stay energetic, but I love to stay energetic. Okay, so let's continue. Next question. How long should I continue? Oh, sure. Well, that depends, right? Again, I think that everyone should be like how long should I be drinking water? Well, as long as you live, you should be drinking water. So my answer to you is yes, I would take probiotic lifelong. The question is what type of probiotics, right? And what strength. So sure, if you are healthy, you may not need probiotics. All you need are prebiotics, right? I mentioned that I think last time on prebiotics, which is the food for the bacteria. So if I'm healthy, I may not need probiotics. I just need some good food like fiber, right? Which is a very good prebiotic, right? Prebiotic stand for food for the probiotic. So fiber is one of them. Anything that is fermented food is considered prebiotics. And I'm sure Heather can give you a whole list of fermented foods that you can consider as prebiotic, right? But again, for those patients who are not as healthy, then yes, then I will put them on probiotics. Well, how long should I take it for? Well, how long do you want to be healthy for? Right? So, depending on the patient's condition, right, I would put them on long term, right? Just like multivitamin, right? And depending on their health status, I may use a lower strength for general health and well-being. For those patients who are sick, then I will use a stronger one. Now, the question that becomes, how long do I use the stronger one? Not too long, right? Assuming the condition has improved, then maybe then we can downgrade to a more general probiotics, right? Unless your sickness is for long term, like very complicated condition, then we might be using a strong probiotic for a longer time period. So I hope that answers your question. How do I kill nail fungus? Well, you can use medication, as of course, right? The over-the-counter toenail polish doesn't work very well. They typically work 25%, according to most studies. So, of course, a stronger way to do it is take medication, right? But the medication have strong side effects. So we have to monitor your liver function when you are taking oral medication for nail fungus. And then, of course, another option is to send you to podiatrist, and they oftentimes they might want to remove the nail, right, as part of a surgical procedure to treat the nail fungus. So those are two main ways, right? Podiatrist to remove the nail for you, or take a medication. There are other integrative therapies, like I know some people might be using tea tree oil, different kind of essential oil to help with nail fungus, and that might be helpful depending on the extent of your nail fungus infection, right? If you only have a little bit of nail fungus, sure, I think tea tree oil is good enough. But if your whole nail is infected, then I don't think tea tree oil or equivalent will be enough. In that case, I will probably either send you to a podiatrist or give you medication. All right. Okay. So far, so good. I don't hear anything. I assume I'm okay. Uh, have you had any experience with milk? Yes. That is, I forgot. Is what's the term for that? But it helps you to generate fluid. It is kind of like a natural moisturizer. It gives you some moisturizing function, right, to improve and can it help decrease inflammation? Absolutely, right? Are there any? No. Well, okay, I will say that. Sorry, somebody is coming. Oh, thank you. close the door, please. Just like anything else, right? Including water, right? Does water have side effects? Yeah, if you drink like that nonstop, right, you can get water intoxication, right? And leading to very low sodium, right? And very low sodium can cause brain swelling. So that's not good. So even water, if you drink too much, have side effects. So anything, if done too much, have side effects, including what is the name for that? I forgot the name, but I know that. Oh, emollient. I think that's what it's called. Let me write this down. There you go. I remember now. Right? It's called emollient. I think that might be the way I spell it. I apologize if I spell incorrectly. Right? So emollient. Uh, 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 right, is something that will help moisturize, right, your system, right? And that is good for your throat, and that is also good for your esophagus, right? It has anti-inflammatory function. Mulan, sorry, somebody, yes. You know what, Colleen? I think in the future we want to make the is she here listening
Yes,
or
I
not?
am.
Oh, good. So I think it's a good idea to make the email questions available so that everyone can see.
That's a good idea.
Okay, good. So let me continue. So I will read out the questions. I apologize. So yeah, so that question was about mullein, right? What so is that emollient that can help moisturize you, right? And can also help decrease inflammation. But again, not too much, right? Anything too much can have side effects, right? Okay. So and the next question, how do we manage a fatty liver? Ah, that is an excellent question for Heather, right? First, you've got to find out why. Why am I having fatty liver? Because of two reasons, right? Either we are eating too much fats, or especially animal fats and carb, too much sugar, right? Remember, I told many of you that as we get older, what happens? Well, we lose our testosterone hormone. And when that happens, I start to lose muscle mass. So what? Well, normally, right, when we eat a high carb or high sugar meal, they get stored in my muscle, right, as glycogen. But as I lose my muscle mass, those extra carb, sugar, no longer have room to go to my muscle. Why? Because my muscle is shrinking. No more space available. So if the sugar or carb cannot go to muscle, where do they go? They start to go to either they can stay in the blood, and you tell me, what do we call when too much sugar stay in the blood? Well, that's called diabetes, right? Too much sugar, eventually. Or oftentimes the extra sugar or carb will start to go to the liver now, right? If there's not enough muscle to go to, they now all go to liver. So the liver become more congested, like what's the dish that we eat? Foie, yeah, the duck liver is the same thing, right? Where the liver is stuffed with fat and carb. That essentially is fatty liver. So what is the first thing we have to do to treat fatty liver? We've got to change our diet, right? This is where Heather comes in. We've got to eat less animal fat and also eat less carb, especially refined sugar, right? And that will help decrease by fatty liver. Then we can talk about, well, besides that, what else can we do? Well, anything that can help liver function will help, right? And we already mentioned one earlier, and that is the NAC, right? NAC can help liver to improve its function. So I will write this down. To treat fatty liver, besides eating a better diet, right, with lower fat and lower carb, we want to perhaps consider the supplement for NAC. NAC. What else? It will be silymarin, right? Many of you have heard of that. Silymarin is also known as milk thistle, right? Milk thistle can also help decrease fatty liver and improve liver function. So I would consider those two supplements, NAC and milk thistle. All right, let me go to the next question. How does one best manage high cholesterol naturally? Good question. That depends. Depends on, again, what is the causes for your high cholesterol. In general, there are two major causes. Number one, stress is one major cause. And second, by dietary, right? If we're eating too much cholesterol, then we have to change our diet, and we can also block absorption of, right? So assuming I am eating too much cholesterol, let's say I eat 10 egg yolks a day. Wow, then my cholesterol could be higher. Well, because that is coming from my diet. So the first thing to do is to change my diet. And number two, we might want to consider blocking the dietary cholesterol. How do we block that? Well, let me share with you. In medicine, we use the drug Zetia. Well, but Dr. Chan, I am not interested in Zetia. I want to know more natural. The natural version of Zetia is called plant sterol. Plant sterol, Sterol. Right? And that's something that is another nutritional supplement that we can give, right? Is plant-based sterol, not steroid, right? And sterol can help decrease absorption of cholesterol. But what about the other reason? If your cholesterol is high, not because of your diet, but because of stress, then what do? We have to work on your stress management, right? And of course, Heather can tell you more. Because when you are under stress, what happens? The liver will directly make more cholesterol, right? So in order to decrease cholesterol, you've got to work on your stress. Another reason is your thyroid. If your thyroid is low, you're also going to have more cholesterol in the blood. Why? Because thyroid tells the liver to reuptake, reabsorb the cholesterol. So for example, the liver is under stress. So liver makes cholesterol. So the cholesterol is sent out in the bloodstream, and therefore cholesterol is high in the blood. Now the thyroid should come in and say, hello, you have too much cholesterol in the blood, especially the LDL, right? So the thyroid will tell the liver, hello, please get back some of those cholesterol. Please reuptake, that's the word, reuptake, right? Or retake the cholesterol that you made back to the liver. But if the thyroid is low, especially T3, which I measure for every one of you, when the T3 is low, then your liver is not going to reuptake the cholesterol. Or if the liver is not reuptaking the cholesterol, they stay in the blood, and therefore your cholesterol remains high. So far, I have outlined three ways, right? Number one, if the cholesterol is due to diet, we want to use a plant sterol. If it's due to stress, we want to deal with your stress. How do we, manage our stress better? Through meditation or breathing exercise or yoga? That will be a question to ask Heather about. So she's the expert in that area. And then when it comes to thyroid deficiency, then I can do the job, right? I will optimize your thyroid, especially T3, right, to help lower your cholesterol. But what other agents do we use? Well, sure. Besides plant sterol, of course, many of you have heard of red yeast rice. but I don't use it in general. Why? Because red yeast rice is a statin. It's a natural statin. So many patients says I cannot use statin because I get muscle aches. Well, then if that's the case, then I'm not going to use red yeast rice either, because red yeast rice is also a statin. Okay. In fact, it is actually how lovastatin, which is the first generation of statin, is derived from red yeast rice, called lovastatin. Sorry, I forgot the N. Okay. So what else will I give instead? Sure, my protocol involve the use of berberine, which is a natural herb that can help improve sugar metabolism and also decrease cholesterol, berberine. And then another fruit called bergamot, B-E-R, bergamot. Right, so those are my top two agents, berberine, bergamot, and then I will also add fish oil, right, omega-3 fatty acid, right, especially fish oil can help decrease your triglyceride, which is the fat and carb in the blood. And then I will also use plant sterol, right, to decrease absorption. So once again, I will typically use berberine, bergamot, fish oil, plant sterol, right? Those are my go-to regimen to help decrease cholesterol, in addition to managing your thyroid and stress. I hope this is comprehensive enough. I read that it is more difficult to lose weight due to, is that true? Sure. Why? Why? Because what is metabolic syndrome, right? It has to do with your, let me write this down for you. It has to do with your sugar metabolism. Sugar metabolism, right? Which is what we call insulin resistance, right? Your body is resistant to insulin. And that has a lot to do with your underlying hormonal deficiency. So if you are low in thyroid, if you are low in testosterone, then you have problem losing weight, because hormonal deficiency creates metabolic syndrome, right? So when you have metabolic syndrome, which is the term we use to describe pre-diabetes, right? Pre-diabetes is also known as metabolic syndrome. And that has a lot to do with underlying hormonal deficiency. If your hormones are not optimized, especially thyroid and testosterone, you will have a hard time losing weight. Yes, absolutely. Okay. Let me go to the next question. What can I do for my arthritis? Well, what is arthritis? Yes, the buzzword here is inflammation of the joint. So the question is, what am I supposed to do for my inflammation, right? Because when you treat inflammation, you treat anything that ends with an IS, right? Anything that ends with an IS means you are inflamed. And that is the major cause for chronic diseases, which is inflammation. So what do we do for inflammation? Right? A, of course, we have to have a good anti-inflammatory diet, right? Lifestyle comes first, which is why Heather is there, right? To talk about the anti-inflammatory diet, right? Such as the Mediterranean diet, which is one of the most studied, right? Anti-inflammatory diet out there, right? And to some extent, the low sodium, right? The DASH diet, right? Can also be useful, right? It's also anti-inflammatory. And we put them together, right? To improve our brain function, right? And again, Heather can tell you more about that. So, so what do we do to decrease inflammation? First, diet, right? Number two, we want to use, again, anything that will help low. We discussed that before, right? There are three major reasons why we become inflamed. Number one is our lifestyle. So we want to treat that. Number two is our nutritional and hormonal deficiency. When we have nutrient and hormonal deficiency, we become more inflamed. And third would be environmental, right? Including allergies to the air or to food, all of which will increase inflammation. And if that inflammation happen to be at the joint, then you get arthritis. Of course, so we can start looking at treating lifestyle, hormones, and allergies. But those are more global, right? So, but what do I do for a particular joint? Then there are other therapies that can go directly to the joint, right? There are other supplements, I'm sure you're very much familiar, right? That can help with inflammation at the joint, right? I'm sure you are aware of um, uh, nutritional supplement like glucosamine, chondroitin, SAMe, MSM, right? Those are different type of nutritional anti-inflammatory agents that have been used to treat particularly arthritis, right? But a bigger picture though is to also optimize your lifestyle, your hormones and other nutrients, and treating allergies, if any, right? And then target, right, the inflammation locally with specific agent. Like when we are talking about arthritis, then we will add, let's say, glucosamine, chondroitin, things like that, right? Of course, at a higher level, then we can start to do other things. And I'll share that with you in here. So besides doing lifestyle, hormones, treating allergies, and also providing specific joint nutrient, what else can you do? Well, I'm sure you have heard of those. Would be, where is the, right here, right? Would be, for example, there are other chemical called peptides, which is protein molecule that we can inject and that can help decrease inflammation of the joint space. You have heard of PRP, right? Which is really a form of stem cell treatment, if you will, right? Can also decrease inflammation at the joint, right? So the natural evolution will be using peptides, PRP, and then other stem cells agents that can also help to decrease inflammation of the joint, right? And therefore treat arthritis. So to me, a comprehensive approach to treat arthritis is you've got to fix your lifestyle, optimize your hormones, treat any other source of major inflammation, including allergies. Then you focus on the inflammation at the joint with target specific nutrients, plus perhaps the newer things, right? The peptides, the stem cells. Okay? All right. Those are how we treat naturally, right? Versus, oh yeah, I can always send you to the orthopedic doctor and get a cortisone shot, right? Yeah, those are fine, but we know that we cannot use cortisone shot for long term because it will actually destroy your joint further. Okay, next question. I had kidney stones in the past. What can I do to prevent from happening again? Sure. Number one, drink water, tons of water, right? Number two, you want to be very careful the type of stones, right? Because the type of kidney stones would determine whether or not you should stay away from certain food like spinach, right? If they are high in oxalate. And also be very careful the way you take vitamin D, right? Because I said that when you take vitamin D, you will improve your calcium absorption. But the calcium goes anywhere and everywhere. So if you want your calcium to go to your bones and not to your kidneys, then you've got to have good K2 with your D3. right? That's why I said don't get anything over the counter that is only D3 without K2. Because without K2, if you only take D3, the calcium, increased calcium absorption is going to go anywhere, including your kidneys, including your arteries, right? And that may not be desirable, okay? And then can you explain the benefit of DHEA? Sure, DHEA basically is the father hormone that do a few things. And write this down for those of you that can see it. Number one, it improves production of testosterone. So without using testosterone directly, DHEA can help a little bit production of testosterone. Number two, it improves bone health. Sorry, sometimes I have typo, forgive me. It improves cholesterol lipids. It improves immunity and also help fight stress. So those are the basic things that you need to know. DHEA, known as the father hormone, could produce testosterone a little bit downstream. It helps with bone, cholesterol, immunity, and stress management. And oftentimes, when you look at your labs, right, for females, typically DHEA should be around 100. And for men should be around 150 to 200. Many of you are very low. So that's why I replenish that, right? That's all, okay? And knowing that adrenal hormones and thyroid work hand in hand, right? So I always tell patients that the adrenal hormones is like a furnace when your thyroid is a thermostat. They work together. So when you balance the thyroid, you should also balance the adrenal. And the first place to balance the adrenal is to provide DHEA as a supplement, okay? What can I do about my hair falling out? That depends on the cause again, right? The two major causes is either you have too much, let me write this down, too much DHT, right? So as my testosterone drop on one hand, also interestingly, my testosterone, even though they are dropping as I age, but it's also being converted more to DHT. DHT or dihydroxytestosterone can cause hair loss, but not that common though. The even more common reason as we get older is not because of just too much DHT. It's actually low thyroid. When my thyroid is low, I get thinner hair, more diffuse hair loss. So we have to do both. We have to treat DHT. How do we do that? Well, typically we give a drug, right? I'm sure you know, called finasteride. Finasteride or Propecia, right? That's the drug that we use to block, right? Oh, but I want something more natural. What is the natural equivalent of finasteride? Sure, and I'm sure you know that too. It's called saw palmetto, right? I'm sure you have heard of those. But of course, saw palmetto is a lot weaker than finasteride, right? So that's always is the challenge. If you want to use something natural, well, they're not as powerful than a drug. And therefore, they don't have the side effect that a drug has either, right? So we can use saw palmetto. Sorry if there's a typo again. Saw palmetto or finasteride can help decrease, right, the production of DHT. And then the bigger player is thyroid, right? Especially T3 again. So we have to optimize thyroid in order to have hair growth. So I would do both, right? I would treat using finasteride as needed, right? With or without thyroid. And I would say that thyroid is actually more common, especially in women, right? In men, maybe more has to do DHT, but in women, especially after menopause, is thyroid until proven otherwise. So once again, to treat hair loss, right, is optimizing thyroid again. Now you know how important thyroid is, especially T3. T3. But then how come most doctors don't even check your T3? I wonder. Okay. And then last question, what can I do about my neuropathy? Yay. So I have discussed that briefly earlier already, right? We can use NAC. I have alluded to earlier that NAC can help peripheral neuropathy, nerve function. What else can I do? B12, right? And other B complex, which is why I always give B complex in my office. What else? Alpha lipoic acid, right? Alpha lipoic, which many of you have heard. Alpha lipoic acid is kind of like the natural neurontin, gabapentin, kind of, yeah? So we can use alpha lipoic acid in addition to NAC and B complex, especially B12, to treat neuropathy. Plus, I will do one more thing, and that will be acupuncture, right? Acupuncture has also been shown to be quite effective for peripheral neuropathy. So I will always recommend patients with pretty bad neuropathy, they need to be on NAC, B12, alpha lipoic acid. Oh, one more, magnesium, always, right? Magnesium, because that can also help with neuropathy and restless leg syndrome, for example. I cannot spell magnesium, sorry, okay? So, right, those plus acupuncture, and that can help slow down the progression of neuropathy. Especially, I can tell you that I have seen many cases where acupuncture really helps, right? Why? Because acupuncture doesn't always work well with joint problem. But when it comes to nerve problem, it works very well, right? So anything to do with nerves, I will almost always recommend acupuncture, right? Good. So I think I have answered all questions in my list. Is there anything else that I can answer? I cannot hear you. You have to unmute yourself.
I have no questions here from the office that have come in other than the ones that I sent you earlier. Does anyone have any questions on the call?
Yes, I do.
Oops.
I have a question for Dr. Chan. Can you hear me?
Mm-hmm.
Okay. Which form of magnesium are you suggesting for what you just spoke about?
Yes. In this case, right, I would do magnesium malate.
Malate.
And magnesium glycinate.
Thank you.
For neuropathy. And how do I get them? You can ask Colleen. Don't ask.
Thank you.
Anything else on this beautiful Thursday, early afternoon, I suppose? What time is it now? Yeah, early afternoon. No? Good? Okay. All right. I will see you next month. Or I will see you in the office anyway. But otherwise, the question and answer format, I will see you next month. Bye.
Thank you. Bye.